whether it is lifestyle or medicines, medical technology or vaccines. Every aspect of healthcare has received global attention over the last 2 years. In this context, the Indian pharmaceutical industry has also risen to the challenge. The global trust earned by the Indian healthcare sector had led to India being called the pharmacy of the world.
See, what happens in India is a very peculiar country. We often get engrossed in the headlines. To me, if you ask me, unless and until healthcare access and affordability is not provided to the rural India, the very purpose of healthcare delivery mechanism in India is going to collapse. There is no doubt on the intention of the present government under the visionary leadership of Narendra Modi. The ambitious program which Prime Minister Narendra Modi rolled out, the world's biggest program Ayushman Bharat, which promised to give healthcare delivery, it has actually not delivered. You go to any rural India, you go to any parts of India, no PSC. None of the doctors willing to go to the remote areas. And none of them even take interest in going over there. Don't look at political brownie points. It's not good for the country. It's not going to help. You have ruined the country since independence in 47. It is high time that we must think about it. And that is what my focus has been on healthcare innovations. This is where India is going to go. This is where India is going to go global. This is where India is going to transform.
A big hello and welcome to the city of dreams, Mumbai. Tonight, the heartbeat of Indian healthcare converges at the prestigious 17th Annual Healthcare Leadership Summit and Super Brand Awards 2026, powered by Pharma Leaders, the healthcare vertical of Network 7 Media Group. This year's clarion theme, Reimagining Healthcare, powering trust, innovation and global impact, resonates with both our triumphs and our trials. Under the visionary leadership of Prime Minister Narendra Modi, India has embarked on a transformative healthcare drive. His vision is bold. Ayushman Bharat, the world's largest government-funded health insurance scheme, bringing financial protection to millions. National Digital Health Mission, creating a unified health ID for every citizen, ensuring seamless access to medical records and digital care. Medical tourism and global hub, positioning India as a destination for affordable, world-class treatment. Make in India for pharma and devices, strengthening domestic manufacturing to reduce dependency and boost innovation. Yet alongside these strides, India faces structural challenges. Low GDP allocation. Public healthcare spending remains at 1% to 2.5% of GDP, far below global peers. Catastrophic OOPE. Families shoulder 39% of total health expenditure, often plunging into poverty after a single medical emergency. Urban-rural divide. Over 70% of qualified doctors and modern hospitals are concentrated in cities, while rural PHCs and CHCs suffer crippling personnel deficits with 68% of specialist posts vacant. Workforce crisis. India's doctor population ratio is skewed and the nurse to population ratio at 2.89 per thousand lags behind the WHO benchmark of 4 per thousand. In this landscape, Network 7 Media Group stands tall as a beacon of fearless journalism, cutting through manufactured narratives with truth, transparency and reform. Founded and curated by Dr. Satya Brahma, the group has carved a unique identity as an independent, unbiased broadcasting powerhouse. His uncompromising pursuit of truth reminds us: if India is to be a global superpower, healthcare will be the prime engine. Distinguished leaders, esteemed colleagues and visionaries of healthcare, India's healthcare story cannot remain one of neglect. Today, at the 17th Annual Healthcare Leadership Summit, Network 7 Media Group rises with a solemn pledge to lift the forgotten, to empower the undeserved, and to build a future-ready healthcare system that delivers access, affordability, and quality for every citizen. We envision a nation where universal access is not a dream but a right, where mobile health units, telemedicine hubs, and AI-enabled diagnostics reach the remotest corners of our land. We call for future-ready infrastructure, smart hospitals, digital health corridors, and sustainable systems that stand as pillars of trust and innovation. We demand quality and accountability, a healthcare quality index that benchmarks excellence, restores confidence, and celebrates institutions that set global standards. We commit to innovation and research to position India as a global hub for affordable breakthroughs in vaccines, biologics, and digital therapeutics. We invest in human capital, empowering doctors, nurses, and frontline workers with training, technology, and dignity. And we forge public-private synergy, partnerships that unite government, industry, and civil society in a common mission of inclusivity and sustainability. This is not merely a blueprint, it is a movement of trust, innovation, and global impact. Let it be declared today, as Dr. Satya Brahma says, India's neglected healthcare will no longer be a forgotten story. Together, we will script a future where every life matters, every citizen is cared for, and every institution is accountable to the promise of excellence.